Good evening. It's January 29th, Monday, 2024. This is Lyle. Just wanted to check in. I haven't been excited enough to do a video for a little bit. Um, I did, of course, last week get my infusion pump removed, disconnected on the Wednesday, which was don't tell me, 24th. And then from there, the 25th of Thursday, I felt great in the morning. It's nice not to have to sleep with that thing. And but by 1 o'clock in the afternoon, I was just wiped out and could hardly even stay awake. Um, they did say when they did the infusion and went over the initial stuff that they give you the first two things they give you are medicine, basically, which anti-nausea and other things like that, just to make you tolerate the chemo better. So they said that lasts 3 to 5 days, and it probably lasted about four. By Friday, I was just trashed all day. Didn't care what I did at all. Barely made it out of the house for an appointment, but did do that. And Saturday, similar, still very just lethargic and not caring about doing anything. I kept thinking, gee, I'll make a video, and then I just never did. I'd get to nighttime, and that would be it. The pain that I had from the fissures has healed considerably. It's hardly anything there at all now. The urgency after I got past the length of the medicine that they gave me, the urgency comes back sometimes. It's still not as bad as it was, but still, I barely made it yesterday one time, so you just never know. Bowel movements have been fine, as far as, not, I don't have diarrhea, haven't had anything like that yet. It's just been a tiring ordeal, I guess, right now, and hopefully we'll see if there's more cumulative effects or if things get a little better on my weeks off. Again, I don't go back until the 5th for the infusion. This Friday I go in for my blood tests and blood work just to see where we are with blood counts and things, the CBCs and things, so that they can assess what they need to do for the infusion on Monday. Anyway, and then Monday I'll go through the full infusion. I've got an 8:50 in the morning appointment with the doctor, the hematology oncologist, Dr. Kashana, he's an excellent doctor, excellent. And then I go from there right down to the infusion center and get to sit there for the next 3.5, 4 hours and do the infusion, then get my pump hooked up again, and head home to drip for 46 hours and see how that goes and see what happens with the pump and the side effects this time. And we'll see if my theory is correct. If next Thursday I go through the same issues, then it's, the medicine does help keep it better. I didn't even have a bowel movement for 2 days, 48 hours after I had the infusion, so the medicine obviously did something. And then it wasn't hard. It wasn't a bad one, so I just wanted to, I was kind of worried about that, especially after having the fissure. I didn't want to have everything ripped up again, because that was really painful. Anyway, so far so good. No matter what I feel about it or how much I don't appreciate feeling this way, it's something you got to go through to get to the end. And that's all there is to it. It's just a means to the end, and the end is getting rid of this tumor. I've seen other things recently with a lot of people that have stage 4 cancer and things, and I'm just glad it's only stage 3 and that there's only local advancement. And that was just, so far that we know of, just the one lymph node. So hopefully everything there will be okay. Again, I won't truly know until we get through this whole ordeal. The last treatment infusion is on the 29th of April. It'll come off on the 1st of May, and then from there we'll start testing again, probably a flex scopes and MRIs to determine the size and the placement of what's left of the tumor, and from there we go to surgery and get rid of the thing, and hopefully from there everything will start getting better. The question, of course, will be where it is, whether I have to have a colostomy, and if so, whether it's temporary, which is normally 3 months, or whether it's permanent. But a permanent colostomy is better than a permanent dirt nap, so I'll take that any day. Anyway, that's where it is right now. Again, still feeling kind of blah, and sometimes some pain, but nothing terrible. The pain more so lately has been my back, which is a mess. But there's nothing I'm going to do about that now because the steroids will mess up my blood counts. So I have to wait until after the surgery's there just to look at any more injections. I had an injection in December, but it kind of didn't do squat. But like they said, the doctor that looked at it said it was hard to imagine it was the same person after seeing an MRI 3 years later. She said it really deteriorated pretty good. So, but as long as I sit down or lay down, I'm okay. It's just sometimes motions that I do standing up, especially sweeping and things like that, that kind of a motion just really, really hurts. So anyway, that's where it is. Hopefully we'll have a good night tonight, and hopefully a better tomorrow. So have a great evening, and we'll talk to you later. Thanks.